I'm Crystal Wright. I am an anesthesiologist at MD Anderson Cancer Center in Houston, Texas. I decided I wanted to become an anesthesiologist. I always knew that I enjoyed working in the operating room.
You literally have people's lives in your hands. We take care of patients' airway, we take care of their breathing, and we take care of their circulation during surgery.
I have specialized in cardiothoracic anesthesia, and I take care of patients that come in for procedures involving anything related to the heart or related to the lungs. And that's a great thing about the specialty. You can make a decision to pursue other specialty areas in anesthesiology. I took high school pretty seriously. It was very important to me to do well. I worked at a hospital for a part-time job when I was in college. It gave me the opportunity to work closely with nurses and work closely with physicians. I always knew I enjoyed science, enjoyed the pharmacology and the physiology aspect associated with anesthesiology. And I also enjoyed the fast pace for college, for medical school, for residency, for 12. All in all, that was 13 years of training. And after your third year of college, you take the medical college admissions test, or the MCAT. You do medical school for 4 years, decide if they want to practice as a general surgeon, or if they want to go into internal medicine, or if they want to do a surgical subspecialty. You have to rotate through at different institutions to help you figure out what's going to work for you as a career choice as a physician. Just like you do for medical school, you go through an application process where you apply to different schools. Those can be challenging times because you're very apprehensive as to where you kind of stand on a national scale and how you compare with everyone else. After their second year of medical school, and then at the end of their last year of medical school, USMLE. It's very important that you do well on that exam because those scores are what residency programs will use to help them decide whether or not you may be a good fit for their programs. Looking at applicant for programs, want someone that's knowledgeable, is able to learn information and can apply it well, can work well on a team. It's professional, good soft skills, and more importantly, you want someone that's compassionate. You want someone that's going to be able to take good care and adequate care of patients, almost like it's taking care of your own family members. Your work ethic is going to be very important, and having a strong work ethic starts from the time that you're in high school. You never know when your day is going to end. It depends on the day, depends on the type of surgery that you're doing. It's because I work at a cancer hospital, call is rather calm, but calls for anesthesiologists can vary. The operating room environment is full of different types of people. We work as a care team a lot. Being able to manage those conflicts that can arise in an environment where you're working with different types of people can be challenging. Hopefully one can learn that while they're in residency and even early into practice. I need to work in a private practice setting where your income can fluctuate. Working in academics provides more of a set salary. It's less than someone that may go into a private practice setting, but it provides a little more flexibility in terms of lifestyle.
Your days are very early.
5, sometimes 5:15, 5:30 if I'm running late. One would think after almost 12 to 15 years of training and practicing anesthesia that I would be used to the early mornings, and that has not yet happened. When you're a female practicing in a male-dominated environment, I think in any profession that can bring up certain challenges. How can you manage work and with kids when they're younger is probably the most difficult time because you're also just starting out. What made it easier is the mentors that I had. I had a female mentor who had kids, raised her kids, and really kind of helped shepherd me along the way during that time. What I like most about being an anesthesiologist is taking care of patients during their most vulnerable time.
I think a lot of people think anesthesiologists don't really know their patients, and we probably don't, but you would be amazed how much you can learn about people talking to them in the first 10 minutes before going to surgery, and how well you can connect with their families in terms of comforting them prior to taking patients back for surgery.